Now has over 61,000 confirmed cases of the coronavirus with over 1,350 deaths. This is an increase of 3,359 cases, taking the confirmed positive cases since March to 61,927. The stats also show that the Western Cape now has more than 1,000 COVID-19 related deaths, accounting for 74% of the deaths in the country and over 62% of all cases. Over 1 million COVID-19 tests have been conducted in the country, with over 32,000 tests conducted in the past 24 hours. Friday's death tally showed that there were 70 more COVID-19 related deaths, with 39 of those who died coming from the Western Cape. Meanwhile, the Health Minister, Dr. Zweli Mkhize, has encouraged other provinces to consider introducing motorcycle ambulances to help manage COVID-19 in rural areas. Mkhize was in the Eastern Cape, where he launched the three-wheeled ambulances. The minister revealed that the demand for hospital beds is continuing to rise in at least 3 provinces. Newsroom Africa's politics editor Sbu Ngalwa has more.
In a rural province with poor infrastructure like the Eastern Cape, a bit of innovation is necessary to respond effectively to the fast-spreading virus. The 100 motorcycle ambulances and some mobile clinics will be distributed to the rural parts of the province. This will speed up the tracking and tracing of possible COVID-19 cases. The health minister is clearly impressed.
We believe that this is a pioneering effort that should be adopted across the country, where a lot of other parts of the country are facing the same challenge. Those cycles, motorcycles, those scooters make it easy for someone who has to walk from house to house, ensuring the health of the people. But what I found to be quite nice is the innovation about it, that it can in fact be converted into an ambulance that can carry someone who needs additional help to be brought to an area where it's easy to access ambulances. And in addition, it can also be used as a mobile clinic for one person.
But concerns about crime remain.
We cannot have a situation where we have no-go areas. That is unacceptable. Those attacking EMS crews are our brothers, sisters and neighbors, and we need to stop burying our heads in the sand, but speak up when we witness such attacks. People can report to the department or the SAPS anonymously.
Mkhize completed a 2-day working visit to the province, where he also noted that the growing infections were putting pressure on health facilities already.
We have increased the numbers of beds and put up field hospitals, but as we now are looking at our numbers, we need to then make sure that we continue to increase those numbers further, just to make sure that we don't end up in a situation where we have more patients landing up in our hospitals than we have got beds for. And so as we move around in the different parts of the country, we can see that the numbers of patients who are hospitalized have increased in the Western Cape, largely in Gauteng and in the Eastern Cape. And so there is going to be a huge demand now for additional beds, particularly in the ICU and high care areas.
As the minister departs, the Eastern Cape is left with the task of managing the rising infections and eliminating delays in the tracking and tracing. The province has the lowest success rate in the country in the tracing of possible COVID-19 infections. For Newsroom Africa, on Channel 405, I'm Sbu Ngalwa in East London.